A very good morning to you, ladies and gentlemen. We live in times of risk and uncertainty, but the good news is that nothing really stopped working because of the current situation, mostly thanks to digital. I welcome all of you to the World Health Organization session on achieving health for all through digital collaboration at the World Health Summit 2020. My name is Sudha Venkatram, and I work with the Department of Digital Health and Innovations at the World Health Organization at its headquarters in Geneva. With your permission, I will quickly go through a few ground rules for this meeting. This is a virtual meeting. Please update your name with your full name and your organization name so that you can be identified correctly. You are welcome to ask questions on the Q&A. We will actively respond to your queries or take note of them and revert to you. If you have any specific questions to the panel members, please indicate your question, and if you would like a specific panel member to respond to it, please mention that as well. We will take note of them and address them after the panel discussions, time permitting. With your permission, we will be recording the session to facilitate note-taking and follow-up. Thank you all for your time and for being here today. I hope all of you have the agenda. It is our privilege and honor to have with us today Dr. Tedros, Director General of World Health Organization, to open this session. I now invite Dr. Tedros to kindly present the opening remarks. Dr. Tedros, the floor is yours. Thank you.
Thank you. Thank you, Sudha. Dear colleagues and friends, as you know, COVID-19 is the first pandemic of the digital age. We're seeing firsthand how these new tools can support our efforts. Digital health technologies are helping to screen populations, track infection rates, and monitor resources. They're also helping us to monitor the social and environmental determinants of health, which are fundamental elements in the fight against COVID-19. And there is no doubt that digital technologies will continue to play an increasingly important role in health long into the future. This is why WHO has made harnessing the power of digital technologies a priority as part of the WHO's transformation agenda. I'm pleased that our new global strategy on digital health will be brought to the World Health Assembly in November, following multiple stakeholder consultations. Underpinning the new strategy is a vision to improve health for everyone, everywhere, by accelerating the development of accessible, affordable, and sustainable digital health solutions. It calls for the use of technology to prevent, detect, and respond to epidemics and pandemics while ensuring the ethical use of health data. These are undoubtedly ambitious goals. Success is only possible with global collaboration and the support of all stakeholders. Digital technologies are powerful tools that can strengthen health systems and improve care, bringing us further down the road to universal health coverage. But they must also be used wisely, with proper safeguards in place to ensure compliance with ethical standards and to protect privacy and confidentiality. WHO recently launched the Digital Implementation Investment Guide. Coordinating investment at the national level will ensure all people can benefit from new technologies. Today, I call upon all of you, governments, development partners, academia, the private sector, and civil society, to work with us to achieve a principled and effective digital transformation of healthcare. A healthier, safer, fairer world is within our reach. I thank you. Vielen Dank.
Thank you, Dr. Tedros. Thank you so much for those encouraging words and for that call to the multi-stakeholder community. I now invite Commissioner Stella Kyriakides, Commissioner for Health and Food Safety, European Union, to kindly present the keynote speech. You have the floor, Commissioner. Over to you.
Good morning, and thank you so much for this invitation. Dear Dr. Tedros, dear Minister, dear Jens, ladies and gentlemen, 2020 will be remembered as a year that changed our world. a year that exposed the fragility of humankind and healthcare systems, and a year that has forced us to reflect and rethink the way we live our lives. Digital solutions, once a tool of the future, have rapidly become essential as the world has fought to understand, to manage, and overcome the catastrophic impact of COVID-19. The pandemic has brought to light the importance of digital technology in medicine and its potential to save lives and support better, stronger, and more equal health and social care systems. I want to focus my intervention on three key areas: how digital solutions enable better health outcomes, what the EU is doing, and what we can do to build global collaboration in this area. First, on improving health outcomes. Digital solutions can radically change the way health and care services are delivered and help them respond better to crises like COVID-19. They can improve accessibility and communication. They can empower citizens, enabling them to actively participate in the management and monitoring of their own health. They bring professionals together to make more efficient use of knowledge and of resources. And they allow better use of health data in research and innovation, enabling stronger and more resilient health and social healthcare systems. It is very important that we are able to move forward with these as quickly as possible in the area of the current pandemic. I want to now focus on area 2 and what we need to do. As we embrace the possibilities of a digital future, we must always keep the human being at its center. It is essential that personal data and privacy is fully protected. The landmark General Data Protection Regulation, which applies in the EU since 2018, was crafted with this in mind. Personal data is not a commodity to be mined like any other for economic gain. It belongs to the person. This is especially important in the case of sensitive health data. Since the start of the pandemic, Europe has seen a huge growth in the use of digital tools in health and care settings to protect and safely connect patients with healthcare professionals. They are a key enabler to allow care and consultations to continue when face-to-face visits are not possible or safe. In France, one of the leading e-health providers reported 4.5 million teleconsultations between February and September 2020, up from 100,000 between January 2019 and February 2020. In the same period, the number of French health professionals using teleconsultations rose nearly 10 times, from 3,500 before the pandemic to 32,500 by September. Looking forward, the EU wants to make more of digital possibilities, to fully exploit their potential to support a sustainable recovery and a more efficient and accessible treatment and care in the future. One of the main priorities is the creation of a European health data space to foster collaboration and to harness data for better healthcare, better research, and better evidence-based policy making for the benefit of patients. It should enable safe and secure access to healthcare across borders. It will also contribute to patient-centered care models to empower citizens and give them greater control to manage their own health. The preparation of the European health data space will focus on 4 main areas: governance and rules, quality of data, infrastructure, and technical interoperability, capacity building, and digital skills. In the first half of 2020, the Commission and the German Ministry of Health organized together a series of expert workshops mapping national health data policies and rules. A report on these sessions is going to be published later on this year. These discussions will feed into our legislative proposal for the European health data space in 2021 and help us to set up the necessary infrastructure to support it. Digital tools undoubtedly offer exciting opportunities to maximize a sustainable recovery from the crisis. They also offer a means to strengthen our immediate response to COVID-19. And here I want to mention the EU's interoperability gateway, which went live last week on the 19th of October. This has been designed to link national contact tracing and warning apps across EU member states to help us break the chains of transmission of the virus. I am pleased that Germany, under Minister Spahn's leadership, is among the first 3 EU countries to link their contact tracing apps in this way across borders. And more member states are expected to be joining soon. From now on, an Irish citizen that has installed his home country's contact tracing app can take a train in Germany, and if afterwards a person that sat close by notifies a COVID-19 infection in her German app, he will receive a notification as soon as possible of the possible risk of infection, even after he's already back in Ireland. All this is done with comprehensive safeguards for personal privacy. In terms of global collaboration, I am convinced that strategic and innovative use of digital health tools can make an important contribution to essential international objectives, like the Sustainable Development Goals. It is important we promote policy decisions on e-health at global level. We can learn from each other and exchange good practice examples. I am very pleased that the WHO joins the meetings of EU e-health network as an observer and was able to present its digital health strategy to EU member states. Such steps help foster the spirit of innovation and worldwide and deeper understanding of parallel strategies as we are facing common health threats together. To conclude, I want to come back to the point that COVID-19 has forced us to rethink the way we live and deliver key services. In April, the Financial Times published an article by Indian author Arundhati Roy, who described the pandemic as a portal, a gateway between one world and the next. Historically, she said, pandemics have forced humans to break with the past and imagine their world anew. COVID-19 has accelerated the use of digital tools in health and made telemedicine more effective and accessible. However, it is also a stark reminder that we must ensure the growth in new tools support inclusive, resilient, and sustainable economies and societies. Every person must be able to benefit. This is our challenge, and we need to embrace it and embrace the potential that digital collaboration offers. I wish us a successful webinar, and everyone stay safe. Thank you.
Thank you so much, Commissioner, for those words. Thank you very much. We now move on to the next part of the session, which is the panel discussion. I would like to invite Dr. Amandeep Singh Gill, Project Director, International Digital Health and AI Research Collaborative, IDARE, who has kindly agreed to moderate this panel discussion. Over to you, Dr. Amandeep Singh Gill. The floor is now yours.
Thank you very much, Sudha, and a big thank you to our keynote speakers, DG, Dr. Tedros, for setting the context for this session, and the Commissioner from the European Commission for underlining the political, national, global context in which this discussion takes place. To dig a little deeper into the theme of the panel, Achieving Health for All Through Digital Collaboration, we have a stellar panel, and I'll briefly introduce all the members of the panel. Here in the room at the WHO, Mr. Bernardo Mariano Jr., Director, Digital Health and Innovations at the WHO. Then Dr. Rajiv Shah, President of the Rockefeller Foundation. Professor Dame Sally Davis, the UK Special Envoy on Antimicrobial Resistance. Ms. Ashat Samia, the Permanent Secretary of the Ministry of Health of Maldives. Professor Mariam Wire, Deputy Chair, the Champions for an AIDS-Free Generation in Africa, and a prominent activist with decades of experience in public health. Professor Alicia Eli Yamin, Senior Fellow at the Petrie Flom Center for Health Law Policy, Biotechnology and Bioethics at Harvard Law School. And we really salute her for waking up so early in the morning to join this panel. So you can see that our panelists represent these different sectors, international organizations, governments, civil society, foundations, academia, and technology developers. The need for all these sectors to collaborate was underlined so eloquently by our keynote speakers. We will begin the panel discussion with Mr. Bernardo Mariano Jr., who will set the context for this panel. The floor is yours, Bernardo.
Thank you, Amandeep. Good morning, good afternoon, good evening. Let me start by perhaps talk a lot about some of the challenges that we have in digital as we go through the digital transformation of the healthcare sector. And then I'll take you through what we see as enablers and acceleration. And then to complete and conclude with the what is it that we should continue to do together to really ensure that the transformation or the digital transformation of healthcare sector is done in a way that achieve and supports the achievement of sustainable development goals related to health, but also it brings those health positive outcomes that we all are looking forward and we want to see. We have currently a health system that has challenges on interoperability. And this is a challenge that both developed world, developing world, low-income countries and middle-income countries have at national level, as well as at the international level. We have challenges on verticalization and siloed systems, both nationally and internationally. We have fragmented and uncoordinated actions on digital health that are not supporting the transformation or not supporting the sector to reap all the benefits on digital health. We have health workforce capabilities, and we have a non-inclusive digital ecosystem. To tackle these challenges and many more that I didn't mention, but those are some that I wanted to just bring to your attention today in today's discussion. There are a number of enablers and accelerations, and the COVID-19 pandemic has shown us that we can actually use the digital solutions to support the public health response, but also to really ensure that we reap those benefits. It's true that we need to look at the ethical consideration and privacy consideration as we navigate and innovate in this space. At WHO, since the pandemic, we had a benefit to engage with 40 private sector companies that created 60 work streams to enhance, update, innovate, and create new digital solutions to support the pandemic. And we are very thankful for all these entities that supported us in this process. To address interoperability, we are working with a number of member states. We have our digital technical advisory group, but as well as a number of member states to address the interoperability issue. We are also working with entities such as HL7 to address really leverage on initiatives that are already out there to enhance the global interoperability, not just national, not just at one province, not only one region, but a global interoperability. On fragmented and uncoordinated challenge, the department is together with ITU and a number of other partners, we are launching a network of networks to bring together all the sectors, not just private sector, not just the public sector, not just the academia, all of them, including civil society, as well as NGOs. In terms of health workforce capability, since the launch of the transformation, one of the outcomes and the idea that came out of that was the WHO Academy. And WHO Academy leans and relies on digital solutions to bring this capability and to all the health workforce. So within the digital health systems, and as well as within this perspective of learning and capacity building of health professionals, we were very grateful to the open source society that helped us to really launch the WHO Academy app that delivered very essential key knowledge on the pandemic to health workforces around the world. We are also working with some member states on the digitalization of the vaccination card. Today, we have as part of the IHR, the International Health Regulation, we have the International Yellow Vaccination Card. So digitalization of that card is one of the initiatives that at WHO we are working with a number of member states to create that transformation. So this is part of what we call a digital transformation of WHO products, services, and content to ensure that at some point as the WHO product, content, and services is fully available in the digital ecosystem. On the challenges of still uncoordinated or fragmented areas, we ensure that by working with the countries, we want to ensure that the investment of digital health addresses the country needs, meaning that the maturity level or the digital health maturity level of the country is key to that is a determinant to guide that investment. So at WHO, we together with some member states, but as well as companies, we are working with the dynamic digital health maturity model, which really rely on a number of tools and that were developed already by some entities, and we're just leveraging on that. The commissioner spoke about contact tracing. We have a number of guidances issued on ethical use of contact tracing, but also guidance on the contact tracing. And we are continuing to work on that area to ensure that contact tracing is part of the public health response and brings and adds benefits, to health benefits that we're all looking for. Now, to realize all that, many countries are investing billions of dollars, especially the developed countries, are investing billions of dollars in the digital health. And we commend those investments, and we look forward to see those investments yield that positive health outcomes we all we are looking for. Understanding that the investment in digital health requires not only to look at the population that are already in the digital space or the digital ecosystem. We want to make sure that we do not leave the 47% of the world population that is not connected to broadband. So inclusiveness is key. So we call upon development partners to support, to make sure that as the countries that have the capacity and means to invest, do invest in digital health, we want to ensure that we also, in addition to not leaving anyone behind of the 47% that don't have access to broadband, we also don't leave anyone behind in terms of countries that are low-income countries or middle-income countries that do not have capacity to fully invest in the digital health. transformation. So therefore, as part of the work of the department, we want to ensure that we are part of that coordinated approach to invest, especially on low and middle income countries. There's a number of initiatives. There are some very good use cases in some countries that yield very good positive results in terms of having a digital health strategy, having a roadmap for implementation, and having an investment case. Dr. Tedros mentioned the recent launch of the digital implementation investment guideline that we co-launched, basically co-created with a number of partners. That is to support countries to ensure that investment on digital health is in line with the maturity of the country, but also addresses the health challenges and bring those health positive outcomes. At WHO, Dr. Tedros also mentioned the global strategy on digital health. I'm not going to go in detail about what it contains, but happy to answer questions. And we have that global strategy on digital health available in our web page. Is a draft strategy waiting for the approval of our member states next month. But to implement the global strategy on digital health, we need to, of course, invest. So at WHO, we are putting together an investment case to implement the global strategy on digital health, which at this current stage is waiting for the approval for the member states. But once it's approved, that investment to implement the global strategy on digital health will require the support of many of the partners that we work with, will require the support of many of the member states, and we're working very closely with a number of member states to put together and to ensure that the global strategy on digital health is not just a document, but it's implemented. When to implement, it requires an investment, and we need to coordinate that investment to ensure that we bring all the positive benefits that digital technology can bring to a country. Thank you.
Thank you very much, Bernardo, for highlighting the key areas where WHO is setting the standards, is coordinating action by governments, and moving ahead in implementation of the 2018 World Health Assembly resolution that called for the development of a strategy to guide appropriate and sustainable adoption of digital technologies. The DG highlighted that this strategy will be presented to the World Health Assembly in November. Bernardo, thank you also for highlighting the importance of coordinated investments. And I think this is a good moment for us to listen to Dr. Rajiv Shah, the president of the Rockefeller Foundation, in the context for the message that he's going to convey very shortly is how do we enable these coordinated investments? What are the key areas in digital health where these investments should be targeted?
Thank you. Good morning, good afternoon, good evening, everyone. I'm grateful to Dr. Tedros and Dr. Kyriakides for the invitation to speak today. Thank you as well to my fellow panelists. More than 7 months ago, Dr. Tedros and I got together in Switzerland the day before he and others at the WHO met to determine whether COVID-19 was a pandemic. In the months since, the WHO, the Rockefeller Foundation, and many of you have run into the fire, responding to this crisis with everything we've got, every tool, every idea, every finding. Unfortunately, too often, over the last 7 months, we've found we don't have the data to best use all of the tools provided by recent revolutions in data, science, and technology. We know we can track, we know we can trace, and we know that if we do both, we can bend the curve of this pandemic. But we need the data to do it all and take people out of the chain of transmission. That's why over the last 7 months, the Rockefeller Foundation has sought to accelerate testing in the United States and around the world, particularly in vulnerable communities. For example, in the United States, we're helping to make 150 million rapid antigen tests available. And in Latin America, we're partnering with the Pan American Health Organization to expand testing and so much more. And in the weeks and months ahead, we'll be announcing additional investments to scale up transformative solutions to equitably distribute COVID-19 testing, tracing, and vaccination solutions to reach communities and people most in need. Of course, even as we try to end this pandemic, we need to start thinking about the next one, to prepare for, visualize, and prevent future pandemics. We need to reimagine the data, tools, and platforms we wish we'd had back in March when I was speaking to Dr. Tedros. For example, imagine if we had a system that gathered and analyzed data from public as well as private, nonprofit, and other sources to track outbreaks, trace transmission, and alert and assist automatically public health authorities and communities even before we decide whether any particular outbreak has become a pandemic. That sort of predictive analysis could not only empower us to confront acute crises, but also chronic diseases in areas like maternal health and diet-related disease, all of which disproportionately affect the most vulnerable. At the Rockefeller Foundation, we believe this sort of platform is not just something to imagine, but something to build. In the months ahead, we intend to make significant investments to incubate a data-driven pandemic action system to reinvigorate public health for the 21st century so that the world can better visualize, prepare for, and respond in real time to outbreaks. We can't do this alone. We need your help. We want to work with the WHO as well as those in local, state, national, and multilateral institutions. Those of you from public entities, nonprofit organizations, the private sector, and academia. If you want to be involved in this sort of international data platform, I hope you will get in touch with me, one of my colleagues, including Dr. John O'Quick, who leads our pandemic's response work. Thank you again for the opportunity to join this discussion today. I look forward to working with you as we continue to respond to COVID-19 and prevent this from ever happening again.
Thank you to Dr. Shah for that uplifting message, a very current message in the context of the fight against the COVID-19 pandemic. We will now move to our next panelist, Sally, Dame Sally Davis. And the context in which, Sally, I'd like you to come in at this point is the fact that there is this uneven spread of digital technologies and advanced digital capacities. This double whammy, which Bernardo underlined, of half the world which is not connected and half the world which doesn't have quality healthcare. And then some of the issues that the commissioner went into, the fragmentation of data and governance approaches, and the lack of infrastructure, the lack of capacity, digital literacy, if you will. So how can we collaborate then in the context of all these challenges and innovate to drive these data-driven insights that Rajiv mentioned? How can we then collaborate to advance policies and actions that prepare us for global health threats and strengthen the resilience of our health systems in the light of the SDG 3 targets?
Thank you. First, I want to thank the World Health Organization and the World Health Summit for hosting this event, and to my friends Tedros and Soumya for the invitation. Thanks also to you, Amandeep, for the question. And I want to congratulate you and thank you for the launch of IDARE, the International Digital Health and AI Research Collaborative. All of these ways of working together will help the world move forward. And it's interesting, having listened to Rajiv, about the need to think about the next pandemic and reimagine, because that's what we've been doing in response to COVID. In partnership with friends in the room today and beyond, we've launched the Trinity Challenge, a coalition of diverse partners committed to using data and analytics to generate and recognize the best thinking to contribute to a world better protected from health emergencies and deliver SDG 3. Context's really important. We observe that outbreaks, epidemics, and pandemics don't impact people equally. As you've said, the use of data and analytics in global public health, particularly the use of non-health data, is not as good as it needs to be and varies across countries. And finally, our behavioral understanding of the drivers of outbreaks, epidemics, and pandemics is lacking. Infectious disease threats, both emerging and re-emerging, start and end in our communities. So our Trinity Challenge is bringing together public, private, and social sectors to better identify, respond to, and recover from health emergencies. Founding members come from across the world, including GSK, LSE, McKinsey, Imperial College, Tencent, Hong Kong University, Microsoft, Internews, Discovery in South Africa, United Health Group in America, for instance. We're focused on 3 core activities which will improve the use of data and analytics and our understanding of human behavior in response to health emergencies. We've launched a new global challenge, incentivizing the generation of novel insights, tools, and approaches. And that allows anyone from anywhere in the world to say they want to join a challenge team and access some of the data, all of the data that these wonderful partners have. We're facilitating unique collaborations, initiating and incubating them to improve responses to global public health threats. For example, the NGO Internews with Facebook are collaborating on identifying and amplifying trusted sources of positive health information. And finally, we're strengthening data analytics and learning ecosystem by contributing some thought leadership and then acting. And a cross-sectoral report from academia and the private sector we will release this week. Our efforts based on 3 core values consistent with the SDG 3, the Global Action Plan, and the WHO's triple billion goals. It's about inclusivity because of our shared vulnerability to health emergencies. So resilience is a global necessity. It's about collaboration. No single action is going to provide the answers we need. And the Trinity Challenge is fostering new collaborations across the globe. And this collision between public health and data science. It's about innovation. As people have already said, data can unlock breakthrough discoveries to inform how we should act to improve outcomes. And of course, this isn't just true for emerging infectious diseases, but also the re-emerging. To prepare for a pandemic we know that's happening, we therefore need to strengthen health system capacity and share data more widely than ever before. So think about antimicrobial resistance, AMR, and the need to promote equitable, accessible, and available antibiotics to all who need them. By ensuring that people do receive the care and treatment they need, we can achieve true healthcare for all. And that's why addressing AMR is integral to delivering the SDGs. Currently in our world, some people consume too many antibiotics, whilst others can't afford them or access them at all. By harnessing digital technology and sharing data, we can help people do local antimicrobial stewardship as well as global surveillance. Using antibiotics only when they're necessary will keep them effective and available for your neighbors, for across the world and future generations. We fundamentally need more evidence of the drivers of AMR so we can target them and tailor our interventions. That will come through data and digital. If we can predict and detect resistant strains or outbreaks, then we'll be in a much better position to prevent them. Surveillance software in clinical settings can monitor patient data and alert clinicians in real time to potential infections and multi-drug resistant organisms. enabling targeted, timely, evidence-based care, which shouldn't be underestimated where there are limited health resources. We need rapid, sophisticated, affordable diagnostics. We need digital collaboration for AMR surveillance. And it's happening like never before. I'm delighted a record number of countries submitted data to the WHO's 2020 GLASS report, which aggregated data from 2 million patients across 66 countries. As this grows, we can support the health of the most vulnerable across the world. By 2021, our UK Fleming Fund will have helped up to 24 countries establish the foundations of sustainable surveillance systems for AMR and antimicrobial use. So, through data-driven practices, we can ensure that our antimicrobials, particularly the last line and resort of drugs, are there for patients who really depend on them. Sharing data and collaborating to deliver digital and mobile healthcare can overcome some of the challenges faced by our countries that lack healthcare infrastructure. We believe digital collaboration underpins the coordinated and systematic approach we need to strengthen health systems and our healthcare. So, I want to just finally highlight that our Prime Minister recently announced that the UK's G7 presidency next year will create a new approach to global health security to protect humanity against another pandemic. We will collaborate internationally, but we need also to develop the manufacturing capacity for COVID-19 therapeutics and diagnostics, build on these global efforts to maximize capacity, including for the long-term supply of antimicrobials. And that will all need digital technology. So it's clear to me, our friends and partners, that there's an urgent need and huge opportunities for increased investments in digital health and AI to accelerate UHC and make the world better prepared for future pandemics. Please join us in the Trinity Challenge. Thank you, Amandeep.
Thank you very much, Sally. You highlighted that our work forward, our collaboration needs to be guided by core values: inclusivity, collaboration, innovation. Those three values you highlighted. It needs to be sustained by concrete challenges, the AMR challenge, which illustrates beautifully the potential power of data and data analytics to address concrete health issues. And that we need to collaborate not only around digital technologies, but through digital technologies. This was, in fact, the context in which the UN Secretary General's high-level panel on digital cooperation was launched in summer 2018. The idea was that digital technologies pose these unique challenges of governance, ethics, privacy protection, violation of human rights. So we need to work together. These are transboundary. These are global issues. Any digital technology cannot be confined, if it's successful, to a national space. So you need to collaborate to govern these technologies, but you also need to collaborate to maximize their use for addressing concrete challenges such as the health challenge that we speak about today. We will now, from this global perspective, go to the concrete setting of a nation, of a member state of the World Health Organization, in this case Maldives. And I would like to invite the Permanent Secretary of the Ministry of Health of Maldives, Ms. Samia, to take the floor now and speak to us about what we can do at the country level, at the national level, to build capacity and ensure that the health sector reaps the benefits of these innovative technologies, data, AI, and digital writ large. Over to you, Samia.
Thank you, Dr. Amandeep. Thank you, WHO DG, Chief Scientist Soumya, the keynote speaker, fellow panelists, ladies and gentlemen. Thank you indeed for the opportunity to highlight unique experiences from a small island developing state. Well, in order to ensure the effective use of innovative digital technology at a national level, it is vital to promote and include digital technology solutions to address health issues. in long-term national planning initiatives. There is also a need to harness the interest of policymakers so that it would be easier to allocate resources and funds for promoting digital technologies for health. We might have very good ideas, but to ensure that the ideas are operational, it's important to engage policy level at all levels. For highly dispersed populations, such as the Maldives, accessibility to healthcare can be challenging due to high travel cost. Utilization of telemedicine services and online consultations could be a potential solution. Use of telecommunications and other virtual means are also useful for conducting awareness and health education sessions to remote communities and even train health professionals stationed in different areas of a country. Maldivians are very tech savvy with a high penetration of smartphone usage. We jokingly say every person has 1 or 2 smartphones in the country. And this is very useful for us as we go on implementing digital solutions from the health sector. In the COVID pandemic too, we were able to utilize online consultations to ensure uninterrupted provision of essential health services, even during the peak of the outbreak in the Maldives. We were at the beginning at a loss when there was everything was closed, but the online consultations helped a lot. This assisted in building trust among the public regarding online consultations. Previously, we have tried telemedicine, but it wasn't well received by the public. But this was the perfect opportunity for the public to learn that online consultations would also benefit public in terms of providing essential health services at the right time. Apart from this, Maldives has also been utilizing mobile devices in the conduction of national surveys and health research, while in the use of digital technology seems promising for Maldives, the sustainability of use in digital innovations such as telecommunications technologies are heavily dependent on the national telecommunications infrastructure and the cost within the country. This could also be a driving factor for the involvement of private sector to utilize digital technology to provide healthcare in a country. Because what we find is all the technology might not be same within the private and the public sector. And the COVID-19 pandemic brought the perfect opportunity for us to work with the private sector to harness the technology in the private sector, because we've been working nationally with all the stakeholders in developing or bringing technology to the people. Capacity to harness digital technology is critical. Such capacity building should not be exclusive to health sector itself, but it should be more holistic, as I mentioned, and cover other sectors such as information technology, engineering, etc., for greater intersectoral collaboration. Such collaboration is evident in Maldives' response to COVID-19 pandemic. Upon recognizing the importance of having timely data to be used to take prompt measures to contain the spread of COVID-19 in the Maldives, an information management system called Outbreak, a mobile supported application and software to record sample data, and an app to monitor the condition of patients in cases called Halubelu were developed. Halubelu meaning just checking of symptoms and checking the daily update of how the context or the persons who are isolated in the at homes were. These applications were used to trace, to monitor cases, to monitor contexts, and to communicate the relevant tasks between different clusters working at the National Emergency Operating Center. Not only at the central level, but this also links with the different centers, operating centers working at different islands. And we have 187 different inhabited islands where we have task force working in each island. So this connects, technology connects all the task forces together. It also connects the health professionals in the national teams with the public itself. Additionally, digital technology continues to grow and evolve. Digital technology is used in communication regarding diagnostic services for highly dispersed communities. It also assists in reducing the overall carbon footprint for a country. This is also very important for us. While these out-of-the-box use of technology can be tempting, it is always advisable to do an in-depth research before investing in particular digital technology solutions. All in all, cost-effective utilization of digital technology to promote health and well-being of the population should be at the epicenter of all decisions undertaken to build national capacity towards the utilization of digital technology in health. On a final note, incorporating routine refresher trainings for health professionals with up-to-date information and opportunities to have on-hand experience with recent digital innovations should also be an area worth investing. So from health side, we've added digitalization and investing in digitalization in the coming years as a priority within the national health planning process. I thank you for your attention.
We thank you, Permanent Secretary Samia, for bringing that concrete national level perspective into our discussion and for highlighting what the DG mentioned at the outset, the wise use of digital technology. So not rushing in, but thinking about cost effectiveness, the appropriateness in a particular context, and the capacity building related requirements around the deployment of digital technologies. Thank you also for highlighting the trust issue. So in fact, we can add that to the 3 values that Sally mentioned just before you, this aspect of trustworthiness in the digital solutions that are rolled out. And also thank you for highlighting the critical role of the private sector, which is a key stakeholder, including through its access to data sets and some of the most advanced human expertise in data science and artificial intelligence around the world. We will continue with our panelists and go now to Mariam. And the question I want to pose to you, Mariam, is following on from what the DG said at the outset, the ethical and wise use of digital technologies for the principled and effective transformation of healthcare. You've heard Sally and now Ms. Samia mention these values. The UNSG's panel earlier spoke of these 9 values. But how do we move from these values and principles, this high-level guidance, to concrete methods and mechanisms to enhance collaboration across different stakeholders? Over to you.
Thank you very much indeed. I thank WHO for inviting me to this panel and thank all who have spoken. And I have paid quite close attention to what you've said. I think that as we deal with digital health, we need to keep in mind what the WHO Global Strategy for Digital Health points out, that it must be within people-centered health systems. So that is the first principle that I would like to emphasize. Our health systems, which countries have people-centered health systems? Now people will sometimes people tell me, oh, but we are looking after people, so we are people-centered. Well, that's not what I mean. I mean people-centered from the universal health coverage perspective. Therefore, health systems must be monitored to ensure that the community level is covered. And the second level, the first facility referral level, is also covered and well-staffed and well-equipped, so that it is truly people-centered. In other words, people have access to quality basic health care services. So that is the first principle. that we must ensure that by saying people-centered, we mean covering everybody. A system that covers everybody and that is backed up with efficient and effective digital services. I have been reading quite a bit on digital services because I think in preparing for this, and the digital things themselves are very fascinating. They can just capture your attention and you get really carried away with the digital aspect and leave the people behind. We must make sure we are not leaving people behind because this digital health is within SDG 3 for healthy lives and well-being for all at all age groups within the Agenda 2030 of the Sustainable Development Goals. So that is the first point. The second point is that to do this, every nation must have a system that is able to do this. Now, unfortunately, commitment is not always there. You may have a system that looks like it is people-centered, but it doesn't deliver. My country has got a system that has, from the community level to the highest referral system, but you find that there is no funding for the community level. So we need to have a system that makes sure that it is monitored to finance the community level, both in terms of services and in terms of digital health. Ethiopia was very lucky to have a very enlightened, committed leader who helped to establish the extension program, the health extension program that was within the government, within pay, and the community level workers were included in the payment scheme of the government. In many countries, we are told, oh, community health workers are volunteers. Volunteers in what sense? In most countries in Africa, the population, more than 50% of the population is below the poverty line, which means that whoever you are working with at the community level is a poor person. They have to, the only thing they have is time. They have to struggle to pay, to feed their families. Then we give them, we train them and say, you are now volunteer community health workers. And we take away the only thing they have, time. And they have no way of fending for their children. I have had the embarrassing experience of community health workers, volunteer community health workers, whose children were almost starving to death because we have excluded them from the payment of the system. We have not provided salaries for them. So we must provide for salaries for community health workers. It's not a by the way system. It is integral to having people-centered healthcare. So we must do that. We must ensure that community level health services are effective. And if they are effective, I will not go into that because there's no time. They are also a very good basis for gathering information, developing information, very critical and supportive to the development of digital health systems. The third point then is, I would like to say is that one of the realities is that some countries are actually very, very hard pressed. Finances are a problem and they cannot manage this. And we must remember that the Sustainable Development Goals, Agenda 2030, is a global commitment. So we must help one another, the rich, the poor, and so on. Therefore, I have been proposing, and I'm proposing again today, that we need to have a global fund for integrated primary health care. A global fund for integrated primary health care that looks after, that supports countries to look after and establish the community level services and effective fast facility level referral and backup system. I happen to have been the chairman of the National AIDS Control Council when it was going to, when HIV hits the world, and the Global Fund for HIV and Malaria and Tuberculosis were very handy. They helped us manage when we couldn't manage as a country. I am appealing to the world to establish a global fund for integrated primary health care. Because unfortunately, although the HIV fund was very useful, it was disease-oriented, not systems-oriented. We were told, you must develop the system, but we were not responsible for the system. So we couldn't develop the system. We need an integrated primary health care fund global fund so that a global fund for integrated community primary health care so that it can actually support every country in every country to have effective community health systems and first level referral systems that will then support the development of the digital services, and the digital services will help to make it effective. The two must go hand in hand. Thirdly, although we have this, although we may establish the global fund for integrated primary health care, we need to be very monitored to focus on access to equity, access to quality primary health, to quality basic health services. Because sometimes, again, my country, I have to say, we focus on very expensive equipment, and some of them are sitting in stores because there's nobody to manage them. So this fund, this global fund for primary health care should be looked after by what I have decided to call the consortium, national consortium, a multi-sectoral national consortium to monitor equity, for improvement of equity to access to health services. And these health services then will reach to ensure that it is reaching everybody along with digital health development. So this national consortium will have sub-national consortia to deal with under the national consortium so that there is monitoring and the funding to the country of this global integrated primary healthcare fund should be through this consortium, the national consortium, which should include specialists in digital health, specialists in primary health care, specialists and so on, public relations people, and so on. I have actually detailed outline what I think they should have. So this should be very, very good because it will ensure that we are reaching everybody and we are monitoring them with effective digital health services. I think that this national consortium should be the chair people from the national consortium should then form the international consortium for improving access to health services. They form an international consortium for improving success that is focused on improving improving access with digital services, right from the community level upward. So that we are not just, we have been talking about health for all since 1978. It is now over 40 years. So we need monitoring, close monitoring, and the world needs to look at it. I think that the business community, international business community, and national business communities should be involved in promoting the global fund, in contributing to the global fund for integrated primary health care. After all, businesses will not work very well when people are dying and there is poverty, and right now there is an economic crisis because businesses are not working well because of the COVID problem. So we need to have this structured approach to monitoring access to quality basic health services. And finally, I'd like to mention that if we have this in place, then we shall respond very, very rationally and more organized to any epidemic or pandemic. One of the embarrassing things to me as a long-term public health professional has been the confused way we have dealt with the COVID pandemic because we didn't have systems in place. If we have the system that I'm proposing now in place, we shall have a very organized approach to epidemics, to pandemics, and we shall even right now contribute to putting COVID-19 to an end. So we need to remember three things that we are dealing with. Agenda 2030, leaving nobody behind. We must provide for the community and upwards. Since some countries are very poor, we need to have a global fund for integrated primary health care. Then we need to have monitoring systems for access at the national level and at the international level, which I have decided to call consortium for improving access to health. And then if we have this, finally and lastly, we have a system to respond to pandemics so that we are an organized approach. Of course, this is inclusive, and research and so on are all involved in all these things. So we must have an approach that ensures that we are working on Agenda 2030, leaving nobody behind in health services and in digital services. Thank you very much, moderator.
Thank you very much, Mariam, for so passionately and persuasively making the case for digital health being community-centered, being built up from the ground upward through national consortiums to international consortiums. And thank you also for underlining the power of something like a fund, which brings together these investments that we've spoken about, which enhances coordination across different investors, and makes sure that we take an integrated approach from research and development of digital health solutions all the way to the community-oriented implementation, including monitoring for access that you mentioned. Now we go to the last speaker on the panel, Alicia, who's been waiting patiently, who's woken up so early in the morning to be with us. I think to close the loop, close the circle back to the DG's words and talk about the ethical alignment of all our efforts so that what we do is inspired by, is driven by the intention of leaving no one behind. And as Mariam put it, ensuring that everyone of every age lives healthily. Alicia.
Well, thank you very much for the question, and thank you to the WHO for inviting me to be on this extraordinary panel. And I'm also delighted to be the last and to go after Mariam's very inspiring talk, which I will pick up themes from. I actually am wearing two hats here. I'm a senior fellow at the Petrie Flom Center on Health Law Policy, Biotechnology, and Bioethics at Harvard Law School. And I'm also a senior advisor on human rights at Partners in Health, which is a global health NGO that works with those who are most left behind. And speaking on my own behalf, purely, I'm going to share a few takeaways from each of those perspectives. First, I'm asked to talk about who are the stakeholders and what are their roles. And I think the Petrie Flom Center, by its very nature, shows what academic centers can contribute in making sure that digital technologies are used ethically and in keeping with legal commitments and norms. We've been doing cutting edge, interdisciplinary, multidisciplinary, policy-oriented research on the challenges and opportunities of incorporating AI as well as other technologies into health, including questions of privacy, racial justice, effects on persons with disabilities, patient safety, liability for years now. And we're starting an AI regulators roundtable, which was postponed because of COVID, but will begin in 2021, which again takes this kind of multi-sectoral approach to have scholars from different disciplines, industry, voices from patient constituencies. And I think that is, as other speakers have alluded to, extraordinarily important because the pace of technologies is very, very fast, but the complexity of questions of legal regulations, and especially across countries, the harmonization of laws and regulations across countries is increasingly important if we care about nobody being left behind. I think one of the important takeaways is that this is not a one-off meeting or even a series of meetings. It's really that health technology assessments should be institutionalized, including some kind of deliberative process. And that is not an afterthought, but that is something we should be thinking about now as these technologies are being incorporated into the WHO's strategy. Then I'm also a senior advisor on human rights at Partners in Health. And there, in terms of the people who should be at the table, I would say that the real experts, the real perspectives that we need here are patients and community health workers, as Miriam so eloquently talked about. And I should say that at Partners in Health, the over 17,000 people that we have working with us, the community health workers, are all paid. We do see them as absolutely integral to health systems. But it's they who understand how the tools work in reality, whether the designs are functioning for people on the ground. I also think that the experience with Partners in Health shows that these are incredibly powerful tools to enhance health systems, to extend and improve service delivery, especially in terms of contact tracing, but they can't substitute for human contact. For example, the digital apps for contact tracing that have been mentioned cannot substitute for the kind of personal accompaniment that PIH has done in TB, in rural Haiti, in the slums of Lima, in West Africa and Ebola, where human beings find out what people in isolation actually need for their children in terms of food, other things. We know that works in terms of containing pandemics, it works in terms of protecting families and communities, and it works in terms of building trust in health systems over the long term. And I know we're at the end of a long panel, so I want to conclude with this, which is I fully support the call for funds to more effectively build collaborative investment in this area. But I also want to say that the promise of the SDGs of leaving no one behind will not be met if we don't change the rules of the game that continue to drive income to be redistributed upward from poor to rich within countries and from poorer countries to richer countries. And technology and the rules around intellectual property have something to do with that. PIH supports efforts for a people's vaccine. So I think that part of unlocking the resources that are necessary to fully use digital technologies needs to include some assessment of those rules, and civil society needs to participate in those conversations. Thank you very much.
Thank you so much, Alicia, for bringing that valuable perspective in, the civil society perspective. You and Mariam strongly brought in some essential considerations into our discussion today, including this aspect of equity. I'm afraid we don't have much time left with us to have a long Q&A session. Your questions have been coming in through the chat, so I'll exercise my privilege as moderator to just pick one question, and then I hope our final speaker can go into some of the other questions which the panelists can't go into. So this question is around trust, an aspect that was highlighted by many of you. How can individuals, health workers, patients, develop trust in digital health technologies? How can we improve the acceptability of these technologies on the base of these virtual technologies, care technologies, on the basis of this notion of trustworthiness? Perhaps we can go to Ms. Samia to answer that question. Would you like to take this question, please? Mic, please, for Ms. Samia.
Dr. Amandeep?
Yes, please go ahead.
Yeah.
we might be having a technical issue there. Is there any other panel member who would like to take this question on trust and acceptability? Bernardo, please.
Thank you, Amandeep. I think we do have a number of, I would say, countries that are doing very well in that area, where basically there is a trusted environment, and that has been seen in the recent pandemic, how the uptake of new solutions was high in a number of countries that have created this environment where ethical consideration, privacy, transparency, and then good, I would say, policies around the use of data, both primary use or secondary use, is provided the confidence to the general population that they, if they provide a set of data, the country or all the entities, the stakeholders that use that data, be it the platform provider, be it the government institution, be it the public sector in general, they have the confidence that their data is protected and is used for the intended purpose and not in any additional purpose. So we have regions that have some strong protection principles for data, but also they have a good transparency that we see that the uptake. Now, trust is an easy word to say, but it's not easy to achieve. So, and it's not something that we can pretend that it is there when it's not there, because the reaction or the reaction of the public, the adoption of the public to that digital solution will actually outline whether the trust is there or not. So I don't want to cite countries because I might get into trouble by forgetting one and not the other, but they are both across Asia, across Europe. There are countries that have a good set of examples that we can use to really encourage that to be the practice. Now, what is happening in the digital ecosystem in this transformation is that we sometimes we take the rules of the games from the physical ecosystem and we transpond them into the digital ecosystem without the due consideration that in the digital world, the one person identity can become multiple identities, because we do have multiple identities in the digital ecosystem. So how can we navigate that? So I think it's important that we reimagined how we build that trust and how we reimagine how do we create the transparency and we are accountable to our actions. Thank you.
Thank you so much, Bernardo. This concludes our panel discussion, and I'd like to thank each and every one of the panelists for the remarkable insights they've brought to this discussion following our two keynote speakers, the Director General of the World Health Organization and the Commissioner for Health of the European Commission. Now, I would like to invite Dr. Soumya Swaminathan, the Chief Scientist of WHO, to present the conclusions, next steps, and her closing remarks. Soumya, the floor is yours.
Thank you, Amandeep, and thanks to all the panelists for this really very rich discussion over the last 90 minutes, starting with two excellent keynote addresses. And I think each of the panelists has brought out elements of the challenges that we face as we are trying to scale up and expand the use of digital technologies, but also the immense opportunities. And for laying out very clearly what are the key areas that we should be focusing on. And I just, in the next 2 minutes or so, want to try to summarize, not really summarize, but the big takeaway messages, I think, which are very useful for us as we are trying to advance the digital health strategy that's going to go to the Assembly, World Health Assembly in November, and hopefully will become a blueprint and a roadmap for what we want to see happen over the next 5 years. And I think the pandemic has brought the world's attention even more on the use of digital tools and technologies. We've seen the huge growth of our dependence, like what we're doing now. And in fact, some of these could also help to address, I think, the other existential threat that we face, which is climate change and of course, AMR. And as Professor Sally Davies often likes to remind us, I think these are threats. We could be faced with a very similar situation with AMR, like we are with the pandemic, with no vaccine, no therapeutics, no diagnostics. And I think we don't think about it that way. But certainly this is helping to remind us. I think the key elements that I got from this was about governance. There's been a fragmentation, a huge multiplication of approaches within countries, between countries. The European Union has come up with a couple of good initiatives, at least for within the Union and for the region, one of which was mentioned about sharing of the contact tracing apps across countries. Because again, in a pandemic, there is no point in having solutions which apply only within your own national borders. You have to have solutions that can work across the world as people are moving around all the time. And the other one is the open data that, again, the European Union has been really championing and pushing for open science, open data. And I must say, I've been impressed by the amount of sharing that's happened, the collaboration, at least on the science side, private sector, public sector, also journals, which have all removed their paywalls. I think this is what we'd like to see going forward in science. And it shouldn't be just for pandemics. It should be for all of our major public health threats, whether it's infectious diseases or whether it's non-communicable diseases. So we need global governance, regional and national systems on things like data sharing, on things like biological specimen sharing and whole genome sequence sharing, because that was what made a difference in this pandemic. On the 10th of January, we had the whole genome sequences of the novel coronavirus, and that enabled both diagnostics and vaccine development to start, within a few hours, and did change, I think, the course of the pandemic. I mean, we'll see with the vaccine trial results, but whatever it is, it's unprecedented to have over 40 vaccines in clinical trials within 10 months of a new virus being discovered. So research has been mentioned again as very important. We've been trying to coordinate across the world a collaboration on research, both on sharing of data, but also on aligning on research questions and priorities. And I think it was Ms. Samia who mentioned the fact that when we start using digital tools in health systems, that also needs rigorous research, rigorous evaluation, health technology assessment. Everything digital is not necessarily going to result in improved health outcomes. So I think keeping the end in sight, what do we want? We want improved health outcomes. We want it to be patient and people-centered. We want community health workers and people to feel empowered. And I think everyone has raised the issue of trust. A lot of the questions in the chat are around trust. And I think, as Bernardo said, some countries have done it, but they didn't do it overnight. Building of trust is something that it takes time, and it's not just, you can't just build trust for digital alone. It's an issue of having trust in general. And I think transparency and inclusiveness in decision-making are key components. So as we go forward, we would be very happy to work with member states, with foundations like the Rockefeller, the Botnar, and others who are really promoting this sharing of the collaboration in the digital space. iDare is a new experiment that is also helping us to learn lessons. The Trinity Challenge is going to help us to learn lessons. So we see all around the world a commitment to collaborate, to learn together, to test systems, but all the while, I think, not forgetting the basic principles that, again, all our speakers mentioned today on respecting equity, respecting human rights, and making sure that we have the gender lens, we have the equity lens, so that we don't leave people behind. We don't want to have a world in which there's now digital exclusion, in addition to all the other vulnerabilities that people face. So on behalf of WHO, I'd really like to thank all our speakers and panelists and Amandeep for moderating this very, very interesting panel. And I can see that we are now on a path, on a track with all of these inputs and ideas to actually come back maybe in a year and see what we've achieved, what we've learned. Thank you so much.
Thank you, Dr. Swaminathan. Thank you very much for those very encouraging words and definitely doing a reality check in a year to come. A special thank you to the eloquent keynote speakers, the wonderful panelists for their insights, and Amandeep for a very well moderated panel discussion. Thank you, ladies and gentlemen, for the engaging discussions on the Q&A and for your participation today. A special thank you to the management of the World Health Summit, the Secretariat, the technical team, for giving us the opportunity of hosting this session. And a thank you is in order to the Department of Digital Health and Innovation and the various teams and our colleagues there who have engaged in the Q&A session and the technical team at WHO. Thank you all for being with us today. Have a wonderful rest of the day. Thank you.